Senator Bob Corker is a Republican from Tennessee. He serves on the Senate Banking Committee and believes that a deal is possible, but only if Democrats meet Republicans halfway. Senator, welcome, sir.
Trace, good to be with you.
I want to kind of expound, if I can, on what Robert Gibbs was just saying, and then I'll move on to your idea for meeting the Democrats halfway. Gibbs says that the big questions will be answered tomorrow night. We've been asking all of our guests this. Does the president have to pick sides when it comes to this public option? I mean, the left half of his party says there will not be a bill without it, and the moderate Democrats say they can live without it. Does he need to pick sides tomorrow night when it comes to government-run health reform?
Well, if he wants a bipartisan bill, there's no question that a public option cannot be on the table. And my sense is he'll allude to it tomorrow night. But I think the White House, after hearing from the American people, especially this August, know what we've known all along, that a public option is not something that is in the American value system right now, and I do not think it'll be part of a final bill myself.
But if the president, Senator, the president abandons that, I mean, he was at this AFL-CIO meeting yesterday. This was a public option love fest. I mean, they were all talking about, oh, the president's he's a man of his word. We take him at his word. He said we're going to have a public option. If he abandons this public option, the left half of his party and the unions will be furious.
They will. I think at the same time, they understand that in order to make something good happen, that we have to be pragmatic. I talked to the White House this weekend, and my sense is that they are going to try to seek a middle ground. We were a little surprised at what the president said this weekend with the unions. We felt like it was a little hotter than we thought he might be at this point. But again, I'm still hopeful that we'll focus on those time-tested, pragmatic things that incrementally move us down the road, that do no harm, but build on this great delivery system that we have by making it more accessible and more affordable. And there are several things that Republicans and Democrats agree upon. It seems to me that with an issue this large, that is what we would focus on. We would be successful and focus on pre-existing conditions, on competition across state lines, on creating an exchange where small businesses and individuals can buy in at the same rates as large companies. Those are things that I think we all can agree upon, and it seems to me that that's the direction we should go. There are other issues where there's strong disagreement. We should leave them by the wayside and, again, continue to improve our system incrementally.
Senator Corker, it's Martha McCallum here. Thank you very much for being with us today.
Hey,
you just
Martha.
touched on something that I've been talking about a lot and looking at a lot, and that is this intrastate, across state lines. Why is it that the Democrats don't talk about this? Why would they be against that? It seems like a no-brainer to a lot of people.
We in the federal system, Martha, have the ability to choose between 5 or 6 plans at a national level where we can choose. We want full coverage, if we want an HMO, if we want an HSA. We can do that, and I don't understand why we don't make those kinds of options available to the American people. In some states, one company can have as much as 80 to 85% of the market share in a state, and that obviously keeps prices higher than they otherwise would be. I do not know why Democrats continue to oppose creating that kind of robust competition, which in every other sector of our economy creates lower prices.
I'm just curious, is there a special interest, that is preventing that? With tort reform, if you say, why don't we get tort reform, everyone says, well, because the lawyers' lobby is so strong. What group is so strongly against this cross-state lines commerce?
The only thing I can think of, if you look at a state like New Jersey or New York, where there's lots of state mandates, they drive up the price of health care. If you allow cross-state line competition, obviously those mandates would probably go by the wayside. So it may be that's the issue. I think for Northeastern citizens, though, they should hope that we would have cross-state line competition, because then they'd have choices where the policy is not driven by state legislators, where basically they have to have so many things covered that in essence it makes it inexpensive or very expensive for them.
Senator, you say the Democrats, you want them to meet you halfway, and the Democrats, a lot of them are on record saying they don't believe you. They don't believe the Republicans will meet them in the middle to create some type of palatable bill that everybody can say, okay, let's do it.
Well, look, in the middle to me are those things that are agreed upon. And again, I think there are many moderate Democrats that would agree with almost everything that I've said here on this program. So when I say reach middle ground, no doubt there are the two sides. Look, I'd love to see tort reform be part of this bill. Is it going to be part of it? I don't know. I know there are 3 or 4 things, though, that we absolutely can agree upon, and I can't imagine why we would not take those steps. This should not be looked at as a political victory. This is something that affects people's lives in a very, very real way. And again, we can take some time to do this. Let's do those things we agree upon that we know will work, will stand the test of time. And let's continue to look at some of these other issues, but let's do so after taking into account the positive changes that we can make together by looking at this in a very pragmatic way. I know there are numbers of Democrats that would agree with almost everything I've said on this broadcast.
Tennessee
Probably
Senator.
everything.
Tennessee Senator Bob Corker. Senator, thank you, sir.
Thank you. Thank you very much.